Member for Barton.
Thank you, Deputy Speaker. I rise today to speak in strong support of the Cheaper Medicines National Health Bill. This is not just a piece of legislation, it is absolutely a lifeline for millions of Australians. It goes to the heart of what we stand for as a Labor government: fairness, dignity and health equity. When I stood up in Parliament for the first time, I used some of my speech to reflect on the history of the seat of Barton and its namesake. Barton is home to working families juggling bills, pensioners who've contributed a lifetime to this country, and migrants and multicultural communities who often face higher health burdens. And one thing I hear from them constantly is the cost of medicines matters to them. During my time at St Vincent's de Paul Society, New South Wales, looking after a broad area of New South Wales with an amazing team of staff and volunteers running Vinnie support centres and vans, and also talking directly with my community, many people make impossible choices, choosing between paying for medication or paying their electricity bill, between putting food on the table and buying asthma medication for children. I think of a young mother from Hurstville who skips her own medication so she can afford antibiotics when her child gets sick, or the pensioner from Beverly Hills who told me she would space out her medication by taking it every second day instead of daily just to manage her expenses. Deputy Speaker, we cannot ignore the pressures of Australian households are under. The cost of living is front and centre in every conversation around the kitchen table, and healthcare costs, in particular the cost of medicines, are one of the sharpest pain points for my community in Barton. Deputy Speaker, no Australian should have to gamble with their health because of the cost of medicine. This bill is about ending those impossible choices and restoring dignity to Australians. We have changed for the better as a nation, and the St George area is a proud reflection of the vibrant and multicultural society we call home. But there are some things that have remained the same, and we should be also very proud of them too. Labor's commitment to affordable, equitable healthcare is one of these things. Medicare is truly Australian. The little green card represents the right that everyone has to see a doctor and access medicine when we need it. Because healthcare should never be about the balance in your bank account, your postcode, your gender or your ethnicity. You have a right to it because you're Australian, and that right is something our Labor government will always fight to protect. In the last term, the Albanese Labor government took up that fight after years of coalition neglect. We introduced brand new policies that have saved Barton residents a total of $10,957,676. I'm going to say that again, Deputy Speaker. $10,957,676. Those savings were delivered in the middle of a cost of living crisis too. The government was able to balance the budget, deliver real relief and begin rebuilding affordable healthcare. They did this through introducing new and innovative policies. One example in Barton is in the Carlton Urgent Care Clinic. And for those watching online, don't forget the Urgent Care Clinic is at 354 Railway Parade, Carlton, open 7 days a week, 8 a.m. to 8 p.m. And all you need is your Medicare card, not your credit card. Another example is the 60-day prescriptions, and another is slashing the co-payment. Let me tell you, door knocking on those policies couldn't have been easier. Locals knew about them, were benefiting from them, and were keen to talk about them. Remember the young mother and the pensioner? They're real people. I met one of them on their doorsteps and the other one while I was working at St Vincent's de Paul. This change will flow through the rest of their lives, not only benefiting their health, but freeing up their budgets. Others had taken their kids to the urgent UCC after a bad fall at soccer, or their local pharmacist had given them a 60-day script for blood pressure or diabetes tablets. Another thing I'm proud of is the advances we've made in treating endometriosis. We added new PBS listings for endometriosis and related reproductive health needs. Again, this slashes the everyday cost for women living with such common but overlooked illness. We also expanded Medicare support so that consultations are cheaper and established the first endometriosis and pelvic pain clinics. These clinics create a dedicated space for women to receive a diagnosis, talk to a trusted health professional and receive local support. I would love to see such a clinic in southwest Sydney should this project expand. Regardless, all of these changes are real and already helping women across Barton. When I met them on the campaign, these families trusted that Labor would continue to prioritise their health, and that is exactly what we're doing. The Cheaper Medicines Bill implements the Albanese government's 2025 election commitment to reduce the pharmaceutical benefits scheme general patient co-payment again from $31.60 to $25. $25, Deputy Speaker. The last time medicines were this cheap was 2004. That was my last year in high school at Danebank. I was living in Hurstville, didn't have a licence. Me and my mates were trying to go and watch the film Mean Girls at Hurstville, Westfield. Do you remember that one? Yeah. Trent Barrett was the Dragons captain, and on the 29th of August, the team pulled off one of the biggest comebacks in the club's history to beat Manly 36-34 at Cogra. And we'll beat them. We're going to beat them again this weekend, just like in 2004. Medicines are going to cost $25. Now, I live in Beverley Park. I have a car licence, and I'm pretty much binging on Netflix on the couch rather than going to the cinema. Regardless of that, what happens at Cogra this weekend, one thing that remains the same, Labor are still committed to healthcare. We're still committed to St George's area, and we're delivering on $25 PBS medicines. I'm glad the Coalition matched this commitment. This is a national issue that we should always agree on. As I said, affordable, accessible healthcare is uniquely Australian, and so it makes sense that both major parties want to see these changes pass. I only hope that the next time we present changes like this, we'll see the same support. Let me be clear. This is not just a health policy, it is a social justice policy. Cheaper medicines mean more than just relief at the counter. They mean people actually taking their medicines as prescribed. That means fewer preventable hospitalisations. It means fewer emergency presentations. It means a healthier population, which is good for patients and good for our health system. It also is good for our economy. Every dollar we put into making medicines cheaper pays itself back many times over because it prevents bigger, costlier interventions down the track. Deputy Speaker, it is the most vulnerable Australians who benefit most. Pensioners in Earlwood, families in Rockdale, young people in Cogra who work 2 jobs to keep food on the table. For them, I don't know, $10, $20 savings at the pharmacy, isn't trivial. It's the difference between financial stress and financial survival. That's why this is what this bill is about. It's about giving people dignity. Deputy Speaker, this bill is not just about dollars and cents, it's about lives. Labor will always fight for the right for good healthcare, and will always champion Medicare, and will always stand for cheaper medicines. I urge every member of this House to support this bill, because in a country as wealthy as Australia, no one should ever have to choose between their health and their grocery bills.